Today the topic of discussion is the urinary cast. The urinary cast along with their significance. So this is the topic. So I'll be looking at individual cast and we'll be looking at the appearance and what do we infer from them. So to start with, we are looking at the hyaline cast. So the hyaline cast, the appearance is that it is colorless. It is colorless. And also the homogeneous. It is colorless as well as homogeneous. So what do we infer from them? The inference is that it is non-specific. It is non-specific, but it is common in case of the pre-renal failure. So in case of the pre-renal failure, we can see the hyaline cast. Next, we will be looking at the RBC cast. So in case of the RBC cast, so here what is the appearance? The appearance is that it is orange red. It is orange red to brown since it involves the RBC. And what is the inference of this? The inference is that it is a proliferative, can refer to a proliferative glomerulonephritis, and this is specific. It is specific to the glomerulonephritis or the vasculitis. Then we'll move on to the granular cast. So the granular cast. So under the granular cast, what is the appearance? The appearance is red to brown appearance. And what is the inference of this? The inference of the granular cast is that it can refer to an acute kidney injury. It may be due to a result of acute kidney injury, or after strenuous exercise you can find the granular cast, or in case of strenuous exercise, or in case of acute tubular necrosis, that is ATN. Next we'll be moving on to the WBC cast. So under the WBC cast, the appearance is leukocytes. There's leukocytes. And what is the inference of this WBC cast? The inference here is that it is pyelonephritis, or can be due to the acute interstitial nephritis, or the atheroembolic kidney disease. So there are so many inferences. Then we are going to look at next the renal tubular epithelial cast. The renal tubular epithelial cast. So under this renal tubular epithelial cast, the appearance here is that it is large. It is large. There is epithelial cells. It is arranged in parallel rows. And the appearance, it looks muddy brown. Now when you are looking at the inference of this, so this is the renal tubular epithelial cast. So here the inference is that the acute tubular necrosis as well as the acute interstitial nephritis. Now we will be looking at the next, that is a waxy cast. So we are looking at the waxy cast. So under the waxy cast, it includes the degenerated granular cast. So generated granular cast. So this is the appearance. Now when we look at the inference, it involves the chronic kidney disease, the CKD, then the obstructive hypertensives, as well as in case of diabetic nephropathy. Next we are moving on to the something known as the broadcast. So the broadcast here, the appearance is that, how does it appear? The appearance is, it is wide due to formation. So it is wide due to the formation of the dilated tubules. And what is the inference? So the inference of the broadcast is that it is maybe due to the advanced chronic kidney disease which has a very poor prognosis. Then we are lastly moving on to the Maltese cross cast. The Maltese cross cast. So here the appearance is that it is highly retractable. So it is highly refractile fat globules. Highly refractile fat globules. So what are the inference of this? The Maltese cross cast, the inference is that it is a nephrotic syndrome. It is a nephrotic syndrome or the Fabry's disease. So a similar appearance is seen in the peripheral smear. So similar appearance is seen in peripheral smear of the babesiosis. So we come to the end of the video. We have discussed the urinary cast and its significance in detail. We have seen the list of the cast, the appearance, and how the inference of this. Thank you for watching, and to learn and grow daily, please do subscribe.